And I'm so excited to be back here with all of you. I am a school psychologist and a university trainer. My research focuses on MTSS, linking assessment and intervention, and addressing the needs of students with math difficulties. And I was excited to have this opportunity to talk about integrating assessment for math intervention. And we're going to think about intervention broadly. We're also going to talk a little bit about core instruction and what intervention could mean there. Because I feel like I get a lot of questions when I talk about intervention about the assessment piece. So I'm happy to add this component to your skill set today. As I mentioned, we are going to be talking about screening, instructional planning, and diagnostic assessment. I'm going to put those two together. I know that people utilize different terms for diagnostic assessment or different meanings, so I'll talk about what I mean by that. And we're going to address progress monitoring and how that is really a dynamic process. So today, our aim is to talk about using the right assessment tools to make the appropriate instructional decisions for students. As you can see here, central to this graphic is that you are linking assessment data to your intervention, and that we are going to be doing that differently depending on whether we are screening, planning instruction for intervention purposes, or monitoring student progress. And so you see here that that link between assessment and intervention is always constant, but the goals might be different if you're engaging in screening or using diagnostic assessment to identify specific instructional strategies for students that have those bigger gaps between current and expected performance, and if you're monitoring student progress. Each of these decisions, screening, intervention planning, and progress monitoring, are connected in a continuum that begins with determining the need for support. So that's where we start. We start with screening. Then we're going to collect additional data, and I'll talk about using survey level assessments for that purpose. Then we're going to match treatment to problem. And in order to engage in that direct link between assessment and intervention, so that intervening stage, we really want to use more diagnostic assessment, or as I wrote here, diagnostic testing. And I'm going to walk through a number of different options that you may have to engage in that process in a systematic way to inform your intervention. And then, of course, we want to evaluate the improvement that students are making through our progress monitoring process. We'll also talk a little bit about how progress monitoring math is different than you might be used to doing in reading. I think one of the most important foundational pieces of the conversation that we're going to have today is how we make decisions about data, and that different types of decisions require different types of data. Sometimes we get caught up in the idea that we can use one type of assessment tool, and in math, we can just use one broad measure even to assess all of the needs that we have when looking at our data. But the truth is, we need to make different decisions, and different decisions require different types of data. So hopefully we'll be able to unpack that for you today in again, a systematic way that seems feasible and usable and doable. So we're obviously talking about screening, and I think one of the things we want to remember about screening is that we are determining with our screening data which children are at risk for math difficulty and who may need additional intervention. But we are also going to take the temperature on the health of the core curriculum and instruction. So there are building level decisions that can be made and goals that can be made with our screening data. In terms of instructional planning, which we had conducted a survey probably at this point 5 years ago now, and instructional planning just really wasn't something that it appeared that school psychologists in particular were engaging in very much. So we had a lot of consistency among screenings happening multiple times a year, usually somewhere between 2 and 3, but that instructional planning piece was completely missing, and the progress monitoring was relatively inconsistent, even for students who are benefiting from additional intervention support. So the focus here, although I will talk about screening, is really going to be on that instructional planning and monitoring progress, and how essential that is if we're really going to move the needle on students who are struggling in our schools. So instructional planning, we need to assist with planning instruction by providing in-depth information about student skills and their instructional needs. So the goal of instructional planning, or the assessment data that we need, is really about what students know and don't know, and how much of that skill they know and don't know. So we may need a different tool than we use for screening, which are much broader decisions about usually risk related to high stakes outcomes. And then finally, of course, monitoring progress. We're evaluating whether students are making adequate progress or need more intervention to achieve grade level outcomes. And the key here for monitoring progress is we're going to need an assessment tool that is sensitive to change over time. And that is one of those key important differentiators between the types of data that we use potentially for screening and instructional planning versus progress monitoring. I just want to note as we continue on our discussion of academic decisions and types of assessment tools, I'm not going to talk about classification decisions today because we're really focusing on the idea of linking assessment to intervention along the way. And so I did not include this classification component in our conversation today. The types of data, again, that we use for classification are also going to be a little bit different because of the type of decision that we are making there. So the emphasis here is on that screening, instructional planning, and progress monitoring. And you can see here on this table that I have three different types of data that you may be exposed to. One is a criterion referenced type of assessment tool. And criterion usually tell us what students can and cannot do, but they don't necessarily take into account variables related to success or failure, just whether or not a student met the criterion or not. We also have curriculum-based measurement. I actually refer to curriculum-based measurement as curriculum-based assessment, which is a broader umbrella term. Under that umbrella term is curriculum-based measurement and mastery measurement. So both of them I will talk about later on today. And then computer adaptive testing. And you're probably most familiar with computer adaptive testing because I feel like that's the one that's most commonly utilized in the purposes of screening. The purpose of a computer adaptive test is to adapt to students' ability levels. The test refines the selection of items on the basis of students' response to previous items and potentially provides a mechanism for identifying skill strengths and areas of improvement. In theory, when computer adaptive tests first came out, there was a lot of expectation and hope that those measures could provide direct links to instruction. But most of the assessment tools that we have available to us are not super successful at doing that. So that's why you see here, when we look at screening, you can use criterion reference measures, you can use curriculum-based assessment, and you can use computer adaptive tools, all for screening. Potentially, that's why we're more successful at screening. There's a lot of tools available for that purpose. But again, that's just giving us some broad information about what our school system needs and or what students we should be looking further at. It doesn't really give us that information that we need to actually plan for intervention. So when we look at instructional planning, we can see that criterion reference and curriculum-based assessment tools might be better choices, again, with the caveat that in theory, computer adaptive tests have the potential to do these things, but maybe haven't met that bar at this point in time. And then progress monitoring, the best tool out there is really curriculum-based assessment. There are some computer adaptive tools that are starting to figure out how to do that. Again, it's not as successful as curriculum-based assessment for progress monitoring. So the one tool that can be utilized across these decisions seems to be curriculum-based assessment. There are some limitations that we have with that tool as well, and I'm going to unpack each of these. The point here that I've been trying to make with these different types of decisions that we're talking about, these dynamic decisions that we're using in a school, is that all of it falls within this problem-solving model that we need to be utilizing. So certainly we're going to use these data to define the problem. We're going to analyze the problem. We're going to think about what are we going to do to solve that problem, whether that's a system level or core instruction problem, or whether that's addressing students' individual intervention needs. And then we're going to implement our intervention or treatment and then evaluate that progress. If we use this problem-solving model effectively at the building level and the grade level, we can apply these various types of data for the different types of academic decisions we are trying to make that are illustrated here in this graphic. That said, we tend to define the problem via screening and then go immediately to treatment. So we tend to skip in schools the process of analyzing the problem and what to do about it. And I think that's why I end up seeing a lot of questions about, well, how are we actually using our data and what can we do to make this process better? Because the current way that the system is maybe operating isn't really getting us what we need to help the students that need the most assistance. So we are skipping part of this problem solving model when we move from a screening decision to find the problem to right to implement treatment. Because we already said most of the tools that we are using for screening are not really good at analyzing the problem. And therefore, we're not really able to match students' needs to their treatment. It is more useful to our students to spend that additional time evaluating the data to align instructional plans with their needs. So when we get to the analyze problem component, we want to identify the reason for the learning challenge that students are experiencing. And then when we think about those action steps, the what to do, we want to link reasons to the treatments that we are choosing. So the advantage of using this approach and thinking about our data differently is that treatment is individualized and aligned to students' learning problems. And this is obviously incredibly advantageous to students who are not meeting grade level standards and do need that additional intervention support. We are going to begin with universal math screening. If you have heard me talk about this before or others that are in our conference today, you know how important core instruction is and that layered piece of support. And so our universal math screening really is important to help evaluate the health of the curriculum so that then we can be ensure that we are providing all students with the most effective practices. So we're going to start with screening and talk about what we know about universal math screening. Once again, when we think about the question that we are asking with these data, we really want to think about how are the students performing in the core curriculum. So we are going to assess all of the students 2 to 3 times per year, fall, winter, or fall, spring, fall, winter, and spring. And then based, for example, on those fall scores, students will potentially fall into 3 tiers. Low risk, or they might need targeted intervention. So they might fall between the 25th and 11th percentile. These are just generic percentiles I'm giving you. Each specific tool has their own designated ways to identify these tiers, but the idea is similar. And then intensive, those students that are at or below the 10th percentile. So what are the types of supports that students need? Do they need enrichment? Do they need some targeted supports, or do they need intensive individualized supports? And then the idea being that you could potentially look at what happens in winter, that second screening, and revise the supports after that winter screening. So ideally, these tests should be brief and very good predictors of year-end performance on high stakes outcomes. So most often we're looking at how do our screening tools predict performance on our state assessments that we deliver at the end of the academic year, or sometimes at the beginning of the academic year. So what do we know? Why and when are you screening? So I already mentioned state tests. So state tests, right, are high stakes outcome measure. The thing that we've learned in the literature, especially, and I know mainly we're talking about elementary age students here, but I want to just address this really quickly. What we have learned is that at that secondary level, the best predictor of future performance on a high stakes state assessment is past performance on that same assessment tool. So state tests are the best predictor of future performance on the state test. So that's the first thing to consider when we think about state tests. The problem with state tests for any other kind of decision that you might want to use for screening is that they're not helpful for checking the health of tier one practices necessarily, and they're not helpful for instructional planning, right? They don't allow us to drill down. They're just these broad outcome measures. The next thing that we might do with screening is use those computer adaptive tests that we've been talking about. They are good predictors of high stakes performance, and they could be helpful for checking the health of tier one practices. But as we mentioned, although they have the potential to do so, most are not super helpful for instructional planning. Part of that is because they use these grouped or broad assessment outcome kind of metrics or scores. And that doesn't really get at what students really know and don't know. And then the last one that we could potentially utilize for screening is curriculum-based measurement in math. Curriculum-based measures in math are moderate to large predictors of high stakes performance. They are helpful for checking the health of tier one practices, and they are helpful for instructional planning. And that shouldn't be a surprise because I already kind of let the cat out of the bag, right, with that table I illustrated to you earlier about how useful curriculum-based measures and curriculum-based assessment can be. In this particular case, I refer to it as curriculum-based measurement because curriculum-based measurement actually assesses grade level outcome um, skills on those tools. So we want to know why we're screening and what we are screening for. The next thing that's super important is to evaluate the tools that are available for screening. And we can also do this for progress monitoring. I'll bring this back up when we talk about progress monitoring later this morning. But this is the academic screening tools chart from the National Center on Intensive Intervention. And why I really like this particular tools chart is that you can get information on technical standards, classification accuracy, and different usability features. And you can compare those features across different tools by using these selections. And they have a really easy to use legend. So it's nice to see what tools might be very useful and if there are overall general limitations of all the tools. And that's important to know too, because it's just telling you what we can do with our data and what our data really can't do. So with computer adapted tests, some examples are STAR or MAP from NWEA or FastBridge when we think about the A math and the A reading scores. Again, I mentioned earlier, they are highly predictive of performance on high stakes tests like your state assessment. The example I have here is the Massachusetts state assessment. And it will tell you who is likely to pass and who is likely to fail. Computer adapted tests were generated to provide indicators of college and career readiness thresholds. They sometimes give profiles of specific skill strengths and weaknesses, but without a lot of clarity or transparency about how those profiles are built, they tend not to be as good for instructional planning and they tend not to be useful for progress monitoring. So they're often composite scores, which is why they're not as useful for those other two types of instructional decisions, planning and progress monitoring. And they are generally are not appropriate for measuring growth over time because they're not necessarily intended to be sensitive to changes over time. With curriculum-based measures are rate-based measures. They are better indicators of students' instructional level. They tell us what foundational skills students know and don't know. We can assess the accuracy with which they can perform these skills and the rate, and they're particularly known for assessing rate. As I mentioned earlier, they have moderate to large predictive validity with high stakes tests, and they provide information on the type of math problem. One of the most important things about curriculum-based measures, however, is that they are sensitive to change over time. Sometimes we joke that they can be so sensitive that we do need to make sure that students didn't just have a bad day because it will get picked up in that data. Once again, on the National Center for Intensive Intervention, you can look at and compare those tools that are utilized for CBM. What's also interesting to note is that some of the computer adaptive test companies also offer CBM embedded. So STAR is a computer adaptive test, but it also has some CBM tools available, and likewise, FAST does the same thing. There's also Easy CBM, DIBELS 8th edition, AIMSweb Plus, and Acadience, which can or used to be known as DIBELS Next. So those are some good examples of different types of tools that might be available to you. Some of these are free. So Acadience has been free. Easy CBM has some free versions to it as well. So that's another important component to think about. When we are thinking about skills, so it's not just about what type of data and what type of decision. In math, we have this challenge because math has all these different components, and we'll talk more about those different components in a little bit. So we need to know, well, if we are going to look at math and we are going to make decisions about math, how do we know that the tool has the skills that are important for us to consider or look at when we think about judging the health of our curriculum, for example? Or identifying students who are at risk for math difficulties and math disabilities. So one of the things that we've been able to discern by just summarizing the literature that's already out there is when it comes to early math skills that are important for students to master, we know they need to master in kindergarten and first grade, understanding quantity, magnitude of numbers, and arithmetic. So we found in our meta-analysis that the most assessed discrete skills, so smaller skills that are reflective of these broader areas across screening tools, are counting, identifying numerals that represent numbers, discriminating between larger and smaller quantities, and then finding missing numbers within a set. And so you can see in each of these pictures some examples of what that would look like in the assessment tool. The other anchors we want to have are the key skills that are required in the rest of the elementary school experience, so grades 2 through 5. So that includes whole number computation, rational number computation, and word problems. Those are the three fundamental key skills that students need to be able to master as they move into that secondary schooling area. So screening measures typically consist of computation and word problems, along with other applied problems related to measurement and geometry. CBM tools are good predictors for students' performance and can be used for screening, and they tend to be constructed in two different measures. One with applied problems, which would include word problems and those other applied problems related to measurement geometry, as well as one that includes just computation. So hopefully you now have a really solid background on what are the types of decisions we want to make with our tools and what are the types of tools that are available to make those decisions. When we have been looking at screening data, we obviously hope you've probably seen these pyramids before. We're obviously hoping that 80 to 90% of our students are meeting our expectations for grade level and are having successful levels of competency through tier 1 practices. Often, though, we see pyramids that maybe don't look quite like that nice model of that 80%. So what you see here are three different illustrations of what your pyramid may actually look like. The first one on the left is basically a 50-50 scenario. So 50% of your students are meeting benchmark, 50% are identified as needing strategic or intensive support. It could also be that you have what we sometimes refer to as an upside down pyramid, and we have two examples of that. In that case, it's more like 80% of your students are in need of strategic or intensive support. And it could be that most of those students fall in that tier 2 bucket, or it could be that most of the students fall in that intensive tier 3 bucket. So you may be facing a different kind of situation. And why I'm raising that when you're looking at your data is, one, we said that screening data is really important to identifying the health of the core curriculum and instruction. And so one of the things we want to be doing, and there is really more evidence growing in the area of math, that it is useful to intervene at the class-wide level before we screen. So I have on the slide here, intervene, don't screen, but really it's intervene before we screen potentially. So if you know that you have an upside down pyramid or your pyramid doesn't reflect what our anticipated model is, it might be really useful to intervene early in the academic year on basic foundational skills. In particular, what we've seen useful and beneficial is computation skills. That's what we know from the literature right now. That 50% or more of your class has not yet mastered, and provide a class-wide intervention targeting those skills. Around 4 to 6 weeks after that class-wide intervention trial, then you can screen. And by doing that, we are likely to increase the accuracy with which we identify students that need specialized intervention supports, because we do know that we have gaps in our core curriculum or instructional casualties that are happening in math. Part of that is another conversation for another day that you might already have had. But so when we intervene first with these class-wide interventions and core computational skills, especially at the elementary level, remember, those are some of the keys foundational skills that students need to leave their primary school setting with. We are going to be better able to identify, we have this from the data, those students that actually do need those specialized intervention support, so we can allocate our resources better. We can reduce the number of students who will require additional supports to be successful because we've already picked some up with that class-wide intervention, and it frees those resources to provide students with or at risk for learning disabilities the services and supports that they require or need. It is referred to by Amanda Vanderheyden and Kowaleski as tier 1.5. So this is the idea that when we see that our core instruction maybe isn't super healthy or our curriculum isn't working for all of our students, we can engage in this class-wide supplement, this tier 1.5, with foundational key skills, and then more accurately identify who needs secondary and tertiary supports. Okay. So with that, we've covered the background of instructional decisions, the types of decisions and the types of data that align with those decisions, and we've talked about screening. So the next section that we're going to talk about is instructional planning. And remember, I folded in diagnostic assessment with our instructional planning goals. This is where we really need to tackle this measurement in math. And we need to recognize the challenges about measuring math because of its multi-topic nature and the lack of a capstone task. So when I talk about capstone tasks, often we think about reading, and in reading, the capstone task at the elementary level is oral reading fluency. It's one that can be utilized across grades. It's a good predictor of other types of reading performance that are important. But in math, we don't have that kind of capstone task. So we need to break down the specific areas of math. Whereas with screening, we can get the picture of how a student performs in grade level skills. When it comes to instructional planning for intervention, with students who are not meeting grade level expectations, we need to get more specific. And we're often going to be talking about skills that are prerequisite skills to those grade level skills. Remembering that math is relentlessly hierarchical. So to get more specific, we need to know what are the key critical skills that are necessary prerequisites for those broader math areas that we just talked about. So we might look at things like basic facts, complex operations, word problems, and fractions. Whereas with screening, we're talking about those broader areas of concepts and applications and computation. And then of course, early numeracy. One place we can identify these key critical skills is from the National Mathematics Advisory Panel. So based on the best available evidence, the National Mathematics Advisory Panel identified 4 critical foundations for algebra, which is really the goal of the K-8 education. And so that includes whole number proficiency, fluency with fractions, key aspects of geometry, such as finding the perimeter, area, or volume of shapes using formulas, and some aspects of measurement. There's much less data available on geometry and measurement than there are whole number proficiency and fluency with fractions. So we might focus on whole number proficiency and fluency with fractions as we think about these key foundational skills moving forward. We can also see in the Common Core state standards, and these may reflect your own state standards, that there are essentially 2 buckets: whole number and rational number knowledge that are important for higher level math content. So we can think about, again, what are the key skills that we need students to master, and we're going to assess and intervene in those areas. And then finally, this is one of my favorite diagrams and ways to think about how we are looking at our assessment and corresponding intervention. This is a summary of the literature, or this is a diagram that Shapiro and Clemens put together, which is the summary of the literature illustrating what they refer to as a keystone model of mathematics. It shows you the skills necessary for math proficiency with the goal of ensuring students are algebra ready by grade 8. At the center of this framework, which I think is particularly important, are math facts, specifically accurate and efficient or fluent performance with math facts. So let's take a brief walk through this model. So it begins with those early numerical competencies that we've been talking about that we know that we are measuring because their measures exist. Counting, numeral ID, quantity, and place value is another one, or that number line sequence that we talked about. Procedural computation, multi-digit computation, word problem solving and algebraic reasoning, geometry and measurement, and then rational numbers, particularly fractions. So we know that fractions are a really important aspect of rational number knowledge that students need mastery over. So again, just highlighting that number combination fluency is the center of this model. And so it illustrates that in addition, underlying all of these are language, vocabulary, and linguistic reasoning skills. And so thinking about that is an important component also of what students know. With that said, it illustrates that we have to have early numeracy competencies. That leads to math fact competency, fluency and accuracy. And then from there, we look at procedural computation, word problem solving, rational numbers, geometry, and measurement. So the way I like to look at it, and I again started with that screening idea, is that we can take our screening and we can think about two big buckets, whole number knowledge and rational number knowledge. Within whole number knowledge, we're going to talk about numeracy, particularly those early numeracy skills, number operations, and word problem solving. And with rational number knowledge, we're going to talk about magnitude understanding. Do students know what a fraction is, for example? Number operations and word problem solving. So we see there's some overlap here, which I think helps build a framework or a model that makes this multi-topic nature of math more streamlined and systematic. The other important thing I just want to say is that it does not need to correspond when you're talking about intervention, doesn't need to correspond with what is going on in core instruction necessarily, because you are focusing on foundational prerequisite skills that link students to access those grade level contents. So it's really important to address those foundational skills first. So this is the same graphic, but now I'm going to illustrate to you that there are numerous kinds of curriculum-based assessment tools that line up with these tasks. So tests of early numeracy, different kinds of companies have different types of numeracy tools. Number operations, so that's usually referred to as CBM computation tasks, which is the grade level task, or sub-skill mastery tasks, which we'll talk more about. And then word problem solving, which is embedded in typically CBM concepts and applications types of tasks or assessment tools. Again, magnitude understanding is in that CBM concepts and application. Number operations for rational number knowledge can be found in those computation tasks or sub-skill mastery tests. And then again, word problem solving falls in that concepts and application component. So you can see how each of these key areas of skill do align with CBM tools. So these are some examples of what these tools might look like. These are some older tools. I don't think they necessarily look quite the same in the current representations, but this is historically what they have looked like. So you can see some of the early numeracy kinds of tasks are on the left-hand side of your screen, and then you see the grade level concepts and application and computation tools on the right side of your screen. For computation, it's usually simple and complex computation that's combined. And again, aligned with grade level expectations. There are also several CBM generators that I think are important. Project STAIR is a specifically around algebra. So those of you who are interested in secondary level, there are some tools that are available through that project. And then Math Facts Cafe for free worksheets. So you can get additional tools there. And just to keep in mind that these tools should not be used for high stakes assessment because they don't necessarily have the same standards in terms of reliability and validity that the grade level tools that we talked about in National Center for Intensive Intervention do have. But they provide a good bridge if you're progress monitoring or doing some deep digging into instructional planning. So the first way I want to talk about utilizing some of these tools is through a survey level assessment. So once we've identified the tools, we can use a procedure called survey level assessment to determine students' instructional level. And this becomes important because we want to know what skills students have mastered and what they're frustrational at and what they're still working on. And so we can use that survey level assessment to do that, as well as to establish baseline levels of performance as comparison for future progress monitoring. We also can use survey level assessment, as I mentioned earlier, to identify the full scope of skill strengths and weaknesses that a student may have. So it works like this. We are going to utilize mastery measures, which refer to tools that contain one or two skills on them, rather than all the grade level skills that we might use for screening, and using those to assess for those key discrete skills that are necessary for students to master. So that's why it was really important for us to kind of walk through what are the key discrete skills that are needed for early numeracy, what are those key discrete skills that are needed for computation, for word problem solving as well. So thinking back again about that keystone model. So we are going to administer the CBM grade level measure in lower grades to find instructional levels. That's one optional way to do it. So if you have a second grade student and you are administering that CBM general outcome measure, which has all the grade level skills in computation, for example, then you can also administer that first grade level one. So you can get a sense of where the students are, what are the skills you're going to drill down on. It's particularly useful right at the higher grade level, so fourth grade level when there's many skills. So let's see, okay, if they're frustrational at the fourth grade level, then maybe we get the third grade level and see what skills the students might possess there and keep working down. Ooh, sorry about that. I consider that an optional step, however, because I think it adds a little bit it's a length and time thing for me. I think you can do the same thing by just knowing the skill hierarchy, using the skill scope and sequence chart that comes from your state standards, that comes from just talking to other teachers in your building and from your curriculum. And you're going to use these mastery measures with one or two skills on them to determine students' instructional level. So, for example, we know that students need to, when you look at that Keystone model, they need to know basic facts, all for math operations, right? They also need to be able to perform multi-digit um, calculations with all four operations. So that right there gives you a scope and sequence. When do you expect them to know those? Well, we know that from our standard scope and sequence that's associated with our state um, standards. So that can just make it so much easier right there. I actually always give math fact assessments first to make sure students have foundational mastery over their math facts, even if they're more advanced in the intermediate grades and even if they're in their early secondary level. You're going to administer those tools until you find mastery, instructional, or frustrational levels. So in this example, I deviated a little bit from what I typically do. I just used percentile according to one particular tool's manual, and we're illustrating what you might do when you look at these data. So we can see this is a first grade student. We've given the MComp, so that's grade level, first grade computation skills. We've given quantity discrimination tasks, a missing number task, and a number ID task. And what we can see from here is the student's frustration, instructional, and mastery levels. So they have mastered number ID, it's 90th percentile. They are working on missing number, so being able to put a number in a number line, and they are working on quantity discrimination, but they are frustrational with grade level computation skills. So that helps us to understand in this graphic what we can assess for these students and what the student knows and does not know. We also can start with grade level expected skills, such as multi-digit addition with regrouping, and then sample back to prerequisite skills. In this case, the student has mastered the prerequisite skills of multi-digit addition with without regrouping and basic addition. So we can be confident that a good starting place for the student would be multi-digit addition with regrouping. So this allows us to map mastery content and then move to the next skill. So in this case, we learned that they have those basic foundational addition facts, they're fluent in those, have mastered multi-digit addition without regrouping, and then it's the regrouping that we need to be working on. So that's just one quick and simple way that we can utilize curriculum-based assessment tools in order to assess students' skill strengths and weaknesses using a survey level assessment. So the next set of tools that I'm going to get into really get more into that diagnostic assessment, thinking about what are the reasons for students struggling, their learning challenges, and then how do we dig even deeper about what students know and don't know. In particular, this is going to be useful for students that are not responsive to intervention approaches that we have already attempted. So if we think about it from that perspective, we might think about it embedded within this data-based individualization or instruction model, which you may have seen. This is a model that's talked about on intervention, the National Center for Intensive Intervention, and I've got the link here on the website as well. It's the idea that for students that are needing targeted supports, we're going to first provide them with a validated intervention program. We're going to monitor progress. I still haven't shown you those progress monitoring tools yet. If students are not responsive, then we are going to dig into this diagnostic data component. And then using that diagnostic data that gives us a better indicator about what is going on with their learning challenges, we can adapt the intervention to better meet students' needs and then again, continue to monitor progress. So I'm just illustrating for you where these different assessment tools are fitting into a larger structure of how we make decisions for students that link assessment to intervention. So I am going to talk about 5 different diagnostic assessment tools that you can use to find out not only what skills students need to be working on, but that can help you to further refine those learning challenges to build an appropriately matched intervention plan. So, we're going to talk about brief experimental analysis, which is a fancy jargon filled term to refer to testing different intervention strategies, fact assessment, so determining the known and unknown skills with basic facts, a concrete representation and abstract assessment, which is evaluating understanding according to, surprise, the concrete, semi concrete, or abstract representations. Error analysis, so determining error patterns and finding misconceptions. And then student interviews and what we can use student interviews for in terms of how or why they are engaging in problem solving the way that they are. So I'll unpack each of these for you before we move on to talking about progress monitoring. So the first is brief experimental analysis. There are a few different ways we can build our assessment when it comes to looking at different or testing different kinds of intervention conditions. I'm going to share with you a couple of different ways that we can do this. The goal is to assess the reason for the academic problem or to test out different strategies and trial different intervention options. I like to think of these, the ways in which we utilize this brief experimental assessment or this trial testing of reasons for students' difficulties in these 5 ways that we know from the literature. So we know that students may not want to do the task, so that's more of a motivation concern. They might not have had enough practice. They might need more help or support. The task that we're asking them just might be too hard, so we need to back up and do prerequisite skills, or they may need help with generalization. They haven't had to do it that way, or they don't know how to generalize or transfer their skills from one kind of task to another kind of task, or have it endure over time. So this very much is aligned with that instructional hierarchy. So the instructional hierarchy is a heuristic that allows us to match our instructional strategies and be flexible with our assistant and move that assistance with students. So the idea here is that we need to assess and learn whether or not a student displays accuracy. So if they are establishing accuracy, they have poor accuracy in a skill, which is what we can get out of that CBM tool, they are working on establishing that skill or concept. And so we want to use strategies that are going to help them with acquisition of the skill. The next step is to look at fluency with the skill, that is efficiency and accuracy. So we might think about that as remembering and retaining those skills and concepts. Then we talk about generalization. Those skills and concepts are demonstrated across academic tasks and situations they endure. And then finally, adaptation. Sometimes folks fold adaptation into a generalization, which is using skills and concepts in an integrated way and applying them to novel problems. So by using the instructional hierarchy, we can map assessment to intervention fairly directly. And we're going to use I'm getting there, we're going to use our brief experimental analysis process to help us discern that approach. So to take this a little bit further with the instructional hierarchy, if a student is falling in the acquisition stage, they are going to demonstrate slow performance that is inaccurate. And the tasks or the instructional strategies that align are implementing explicit instruction with modeling and guided practice and immediate and corrective feedback. For the fluency stage, we're talking about students that show performance that is very accurate, but is still slow. So they really need focus on developing fluency, which we can do with opportunities for productive practice. And then when it comes to generalization, we might need to help students engage in self-monitoring and self-regulation or improve student attention and focus, or just help them make the direct connection between the skills they know and the skill that they're being asked in the classroom. So the goal here with diagnostic assessment is to refine the assessment to find the reason for the math difficulties. So we already also talked about potentially that there could be a motivation challenge. So we can simplify those 5 reasons for academic problems into 2 areas, motivation or skill, and then break that down to determine what stage of skill development the student falls within. This refers to the learning hierarchy, and with our curriculum-based measures, we can determine whether a student is in the acquisition or fluency stage of skill development. So here, we're just taking those 5 reasons and breaking them down into 2 big reasons, which is, do they have a skill deficit or a performance deficit, or actually a third, a combination of the 2. If they do have a skill deficit, is it in the our students' skills in the acquisition stage or in that fluency stage, which will direct the types of instructional strategies that are going to be most useful for them. So we want to rule out skill and performance deficits. The skill deficit, students can't do the skill. Performance deficit, students can perform the skill but chooses not to. So if we just do that, we refer to it as the can't do, won't do assessment, which is a variation of that brief experimental analysis that I've been talking about. So a can't do, won't do is simply we provide, we already know their skill that they need to work on. We're going to give that baseline skill. And then we are going to have a treasure chest of rewards that are age appropriate for the student. And the goal is to see if they can beat their baseline score by 20%. And we also might want to look at what would mean the student is no longer at risk according to the criteria measure or the cutoff on our tool. So that's where we get the combined. Yes, maybe they are 20% higher than the original score, but they might be falling below benchmark still. So that is important for us to know as well. So I'm going to show you an example of what this might look like. So here we have our first tool. This is digits correct per minute. We see that the student performed 12 digits correct per minute with that standardized instruction. We then offer them the opportunity to beat their score. We give them that treasure chest where they can make a choice of what they want to do. And we see that this student actually performed more than 20% better. That dashed line represents what the score would have been if they met that 20% requirement. But in this case, they actually had about a 60% increase. And the line that you see represents the difference between mastery and not mastery. So in this case, the student does not necessarily have a skill deficit. Looks like they have a performance deficit. So we don't need to provide those skill-based intervention strategies. In comparison, we see this particular student had 5 digits correct per minute with those standardized instructions. And although they beat that 20% goal that we had, they still are far below the line that would indicate that they have mastered the skill. So we might suggest to us that they do have a skill deficit, but motivation is also going to be an important component of their intervention strategy. So we might call that a combined skill and motivation deficit. So that's one way to think about how do we use intervention trials to unpack what are the instructional strategies that might be relevant. Now, going back to the full scope of things that we can talk about, we can also talk about acquisition and fluency. So thinking about what type of skills. So when we are testing intervention strategies, we might think about using incremental rehearsal, flashcards, or cover copy compare to test whether acquisitions instructional strategies are most helpful. We can use something like explicit timing to see if a fluency strategy is helpful. And then again, we can look at motivation and engagement by giving either positive reinforcement through a prize or negative reinforcement through a break from problems contingent on completing problems. So this is how that might look if you use those different types of tasks. So what we did here in this example, baseline is represented by the orange bar. So that's their standard performance without an intervention strategy provided. Then we're going to assess the same skill, but now we're going to use cover, copy, compare. And that's what you see in that teal blue color and see how students perform when they're given cover, copy, compare. And then we look at their assessment again. And in this case, we see that there was an increase. We also tried out fluency intervention to see how the student performed when we gave them explicit timing. That's in that orangey red, I guess it's red bar that you see in the middle. And we can see they did not do better than baseline. And they did not do better than the cover, copy, compare. We also tried out those motivation and engagement strategies with the student. We gave them a break card contingent on performing a certain amount of math problems. And we can see that was helpful. And we also saw that reinforcement is helpful as well, but not as much as the break card, for example. So we tested those 2 best performing interventions again, which was cover, copy, compare, and the break card. And we see that performance again outperformed baseline. So this graph suggests that the student performed better when given cover, copy, compare, and a break, suggesting they benefit from an acquisition intervention and with motivation that included that break card. So it gives us 2 specific strategies that we can then actually utilize in our instructional plan. There are lots of alternatives that have been recommended in the literature to the can't do, won't do, or the fuller model that I just described where you assess acquisition strategies, fluency strategies, and different motivation strategies. So one idea is that you can look at different types of counting strategies. If students are demonstrating immature counting strategies and they're in the kindergarten to first grade, you can teach counting strategies in different ways, such as using starting with the larger number and then counting up, or decomposition. You could also look specifically at just fluency interventions, so not having automatic retrieval of basic facts. Okay, so which of the things work better for these students? Is it explicit timing, flashcards? Is it self-monitoring with goal setting and reinforcement, or computer-based practice? So there's lots of different ways that you could trial different instructional strategies to see what works best for students that line up with the reason why students might not be responding to that intervention. The other one that we can utilize is a fact assessment. So we talked about math facts as being core to that keystone model that Shapiro and Clemens have just recently described. And that's particular again to K8 instruction, particularly K6 instruction. So what we can do with this fact assessment is we can actually determine. So this is an example, a book that I wrote a few years ago. I have one of these fact assessment worksheets in the back, and it shows what's the number combination that you provided to students. You might use flashcards. Did they answer it correctly? Provide within 3 seconds. If the answer is yes, then you would not complete the rest of the worksheet. If the answer is no, then you might assess, did they provide the wrong answer? Did they provide no answer at all? Or did they provide the correct answer, but after 3 seconds? That's going to tell you something different about their responding. And then can they resolve an error that they made using a number line, counting on or up, using a decomposition strategy, or using a doubles plus one strategy? So at both what their answer was, as well as if their answer was incorrect, how was it incorrect? We can also think about, again, that repeated addition, doubles, using known facts, or skip counting. Did I apply any of those strategies in order to try to correct it? So that gives us a notion of what kinds of facts are missing, are how and why are they missing. So it gives us, again, a deeper dive into what is happening with students' performance. And then this one is the concrete representation, or semi-concrete and abstract assessment. So really looking at that three-dimensional, two-dimensional, and then symbolic representations of numerals. And so this allows us, you can build this, actually, this concept with any kind of key skill. The idea is that you have some receptive tasks and some expressive tasks, and that you have them across these three areas: concrete, semi-concrete, and abstract. And so this is just one example of how to do this. Um, so in this example, we are looking at the meaning and the writing of fractions, and we are going to, for example, show them one 100s block, two tens blocks, and three, or one 10 block and three, I'm sorry, two 1 blocks. And so we are asking them which represents 1/10. And so that's the receptive task. The expressive task is asking them to tell you what 1/10 would look like with blocks, right? So that's what I'm trying to illustrate here. Then with the representation, you're now not using a concrete option. You don't have those blocks anymore. You are going to ask them to circle the picture that represents, for example, 1/100th. And so they are going to properly circle which of these three represents that. And then the expressive task would be to color in 1/100th on this grid. So you can see the difference in the tasks is that across representations is that one is three-dimensional, the other is two-dimensional, and then they have a receptive task. They're just given several options and they're supposed to choose the correct one, or they have to create the answer. And then the last one is abstract. So for example, circling the fraction that is 1/100th, and then they're supposed to circle that, or they're supposed to tell you how many zeros are in 1/100th and how many decimal places. The idea behind this assessment is that there are around 10 problems to solve at each level, with half representing receptive and half representing expressive problems. And if they get 5 out of those 5 problems for receptive and 5 out of 5 for expressive with concrete, for example, then they are good with those concrete representations. But maybe they don't do as well with representation, with semi-concrete representation. So if they answer 3 or 4 items correctly, they might be in the instructional range, and then 2 or fewer, then they're in the frustration range. And that helps you to target where a student is performing. The other one is to simply do an error analysis. So here you are identifying the target skill. You can create your own error analysis chart, administer a CBM tool or computer adaptive test might give you some of these data, or even a unit test. You're going to score the test for error types and record those results on an error analysis chart. So this is an example that we have in our book. And it is an example that we generated based on the literature for what happens with multi-digit computation for addition and subtraction. There can be basic fact errors, there can be omitted procedural steps, there can be visual spatial errors in setting up the problem, there can be challenges with switching operations, and there can be also challenges with place value. And so the purpose of this error analysis document is just to identify what are the errors that students are making specifically within this idea of whole number computation. And from that, we can then specifically target our instruction. And then lastly, we can talk about interviewing options. So we can ask the student to verbally explain their thinking before, during, or after problem solving, play the role of the teacher and demonstrate how the problem is solved. We can ask them to demonstrate the problem step by step and explain why they chose a particular approach to solving the problem. And then lastly, they can identify an error made intentionally by a teacher. So in this case, the teacher's demonstrating the problem and making specific errors and seeing if the student can catch those errors. So that gives us another opportunity to think about what does the student have mastered or not mastered about the process of solving that problem. So we've covered now some specific diagnostic kinds of tools that you can build and that you have, or maybe have available, and how you can assess the tools that you have available to think about how do we link assessment to intervention. The last part of what we want to talk about is that progress monitoring piece, because that's really what tells us whether or not students are making the progress that we anticipate them to make. So I encourage you to think about, do you have a plan of who is monitored for math in your district? What is that plan? What do you think is done well, and what is missing that could be added? So again, we have to think about that fact that math is multifaceted, and there's implications to multifaceted math in how we think about progress monitoring. So let's revisit. We mentioned that math is multifaceted. There is not one key area at the elementary level that students need to be familiar with, but we do know that they need early numeracy concepts like quantity, magnitude, and calculation, and they need to know simple and complex calculation and word problems. We also said they need to know fractions. So we can break down that multifaceted math area into key critical components. So basic facts, fractions, early numeracy skills, which I don't have in a circle here, complex number operations, word problems, and then of course we want to be algebra ready. So we can think about algebra. Once again, we can find appropriate progress monitoring tools using the tools chart on National Center for Intensive Intervention. And again, you can compare different tools in terms of reliability, validity, and usability. You can look at growth standards, which again, we said is one of the things that's really different about progress monitoring compared to screening or instructional planning. So I just want you to be aware of that. Then we want to think about who actually needs to be monitored. So I like to think about students that are slightly above the risk criterion on your screener being monitored on a monthly basis. So taking a more proactive approach to thinking about who is going to potentially be at risk. One of the reasons why we have really dove into a multi-tiered system as a potential answer to the kids that got lost in our system is this idea of linking data to intervention and making sure we can catch all kids. But even with our screeners, we have these kids, right, that don't quite hit that criterion that we have already identified in our system or using our screening tool to need services, who just maybe aren't quite there. They're not quite making that progress. And if we screen them monthly, or progress monitor them monthly rather, then we can get an assessment of whether those students actually are okay or whether they're actually not okay quicker than waiting for that. Let's say we did the screener in fall, then waiting for that winter screener. So I think monthly kind of monitoring that group of students, if you have the resources and capacity to do that, can be really helpful, particularly in key skill areas. And again, we've already divided our conversation into what are those key skills, because we're not going to monitor all math skills. We're monitoring key math skills that students must master in order to be algebra ready by grade 8. The other thing to think about when we talk about monitoring is monitoring students biweekly. Students receiving targeted support, so we think about that traditionally as tier 2, and students whose intervention supports we have faded. So I do want us to remember that when we have provided, let's say, tier 2 supports to a student, that we also continue to progress monitor that student when we have removed those supports to make sure that they are still performing the way that we expect them to perform without those supports. Again, thinking about how are you progress monitoring in a proactive, preventative way in your system, and can you make those adjustments? So that's really important to build into your system. So that might be biweekly, every other week. And then lastly, weekly. So students receiving intensive supports, at minimum, we want to be providing the progress monitoring data weekly. Those includes sometimes students with IEPs as well. And potentially we can use some of our tools on a more frequent basis than weekly. We can use them on a daily basis or every couple of days as well. So how are we thinking about who needs to be monitored? The other way that I feel like math is really different than reading when we think about how we're using our data and what our data look like is how we monitor student progress. So I really recommend that we monitor student progress two ways for students that are receiving targeted or more intensive intervention supports. One, we look at that grade level content. So usually that grade level content is consistent with the screening tool. So it's a tool we already probably have access to. I refer to that as a general outcome measure, or a measure that is going to assess all the grade level skills that we expect students to know at the end of the year, right? The other thing that is really important for students in that targeted or intensive, who need targeted or intensive supports, is really looking at those sub skills. I've been referring to them as mastery measures, which are those smaller, like we refine that measurement tool to just contain one skill or one or two skills that are those key critical skills. So we are talking about having isolated just addition facts on a tool, or we isolate just 2 by 2 digit addition on a tool. So monitoring both those ways is helpful, and they tell us different things. So by looking at all the grade level skills, we learn, are students making progress on grade level skills? And then if we look at the mastery measures, we are talking about, are students learning each skill along the way? And that's important because one is looking at those annual goals, that grade level goal, and that's really our ultimate exit criteria. And the other is looking at those short term objectives. Are students mastering those short term objectives over time? We also want to think about when we use these two different types of tasks or tools, that the general outcome measure, we're only capturing that data periodically. Like that might be every other week or monthly, because progress on those tools is going to take longer. Whereas sub-skill mastery, we're going to want to monitor weekly and change skills as students master them. So let's give you an example here. So this is monitoring progress in math. So the grade of record is third. The screening tool that we had was an MCOMP tool. The student was performing in the frustration range below the 25th percentile. And so our survey level assessment illustrated the following: that they were frustrational in 2 by 3 digit multiplication with and without regrouping, that they were frustrational in mixed basic multiplication and division facts, that they were frustrational when we gave just plain single digit division facts. They are instructional at single digit multiplication, and they've mastered 2 by 3 digit addition with and without regrouping. So our long-term objective, which is going to have a lot of slow progress, so we're going to only monitor periodically, so maybe monthly, would be that grade level MCOMP. And then since they've already mastered the complex addition, we want to maybe focus on single digit multiplication and division, because those are the next two skills sort of in that scope and sequence. One is in the instructional range, so they're going to probably focus on fluency building, and the other one is in the acquisition range. So we're going to provide more support for students in that area. So then we're going to monitor progress specifically in those two skill areas, and likely separately. That's our short-term objective. So we expect faster progress so we can monitor students more frequently. So from this example that I just illustrated, we're going to identify two ways we're going to monitor progress. Again, we are going to use that once monthly check progress on grade level tool. So in this case, it was the MComp. If you are thinking about this more broadly, it could be a composite score on a screener that has shown to have some sensitivity to change over time, or it can be the concepts and application tool as well. In this case, we said we were going to monitor weekly short-term progress on multiplication using curriculum-based measurement and division using curriculum-based measurement. And then later, when students master those skills, in this example that I showed you, you might move to 2 by 2 digit multiplication with and without regrouping. So that's how you would monitor many of these different skills along the way as students master them, periodically checking those grade level skills as well. And that allows you to answer, are students making progress on grade level skills, and are students learning each sub skill along the way? So with that, I know we've covered a lot of different information on assessment tools. I want you to think about what two key ideas do you want to take back with you on our conversation about using assessment to drive intervention. And at this point, I will stop sharing because I'm happy to take questions.
Thank you, Dr. Cotting. There are several questions in the chat, and you do have access to those? Yes?
Yes, I can see the chat.
Okay, very good. I'll let you take it away, Dr. Cotting.
Okay. So the first question is, what do we do with students who are at the 26th to 30th percentile? They still need help. I agree with you, Diane. And so I think we need to know, obviously I have mentioned, or I've caveated our conversation a little bit by saying different tools that you may be using have different benchmarks for whether a student falls into needing tier 2 services, right? And so we're talking about that traditional 25 percentile cutoff. And this is where I really think progress monitoring, and hopefully Diana answered that question for you, is the answer here. We can monitor progress of students in the 26th to 30th percentile. We can do that on a schedule that we've identified to see how they're doing and check in more often than waiting the full 3 months until the next screener occurs. And that way we can pick up those students when they see that they are not making the expected progress. The next question is, if you complete a screening, what are your required actions? I think there is a misunderstanding within my district. Oh my gosh, Jen, I am not entirely sure which direction you are going with this question. So I'm going to try to answer this in a couple of different ways. I have learned we are actually doing this big project where we're looking at the different state guidance that exists in like a comprehensive documents, for example, across different states, and seeing that the term screening is being used differently sometimes in different states. So I really appreciate this question because of that observation that we are making. So screening is really, again, intended, the traditional idea of screening, the way that I've been talking about it today, is that screening is intended to check the health of your instruction in your core curriculum, as well as identify those students that might need additional supports. And by doing that, we're going to only do that periodically throughout the year. It's recommended in math 2 or 3 times that you can do that. So hopefully that's helpful, which is different than progress monitoring, and which progress monitoring is intended to be done with students who are identified as needing additional supports. Okay. So this is another question. It says, this is interesting what you just said. Did I hear this correctly? It is not critical that intervention aligns with core curriculum, because if we are focused on foundational skills that feed into core skills, we are essentially providing them with building blocks to access the core. Yes. Eileen, yes. There are caveats, of course, that you're going to run into as students progress through that elementary school curriculum and potentially are behind in lots of skills. And it becomes a little bit different at the secondary level when we then need to think about accommodations. And then do we need to address foundational skills, like let's say in 6th grade, for students that map directly to what they're doing right now and then back them up? That gets more tricky as we get into those 6th, 7th grades when we have students that have a lot of gaps in their skills. But generally, yes, that's what I'm saying. Would you not recommend an item analysis on discrete skills on a screening assessment like Acadians to guide instruction? So that's a good question. That's really a resource question. So everything, the way I've been talking about how to utilize screening, instructional planning assessment or diagnostic assessment and progress monitoring is in a sort of with the idea of being resource efficient in mind. I in truth be told, I am a big fan of the problem solving approach all along the way. I don't love the idea of having a screener and then sticking a kid into an intervention based on a screener, but that is more efficient than doing what you suggested, which is an item analysis on discrete skills on a screening assessment to guide instruction. So you can do that too. I'm just giving you the sort of resource efficient way to approach it, but there's you certainly can drill down into those skills in order to assess more students' needs. And also, when we talked about class-wide intervention, you would really actually have to do that in order to target correctly the skills that students need for that class-wide intervention. Okay. The next question is, oops, oh, there's a lot of questions coming. I'm sorry, I'm losing track of my chat here. Where do we find suggested diagnostic assessments for math? In ELA, we have, yeah. So math does not, so you probably saw when I talked about diagnostic assessment, all of these diagnostic assessment tools have been written about, experts have used them and recommended them. They do not have explicit scripted forms. And I think that is a definite limitation. The nice thing is that they're flexible. You can just use the slides I have and build those procedures yourselves. And also use the tools that I provided that are not like some of the Math Fact Cafe, for example, to access tools that you can build. But again, don't use those for high stakes assessments. So we don't have anything super structured in the way that you're talking about. How do you consider ROI or lack of response when using sub-skill mastery? What is the criteria for lack of response intervention? Thank you. You're right. I didn't talk about ROI at all. I like to look at my graphed data. That's how I make those decisions. What is the criteria for lack of response to intervention? So I think that is a big question. The way I like to unpack it is exactly how you started to, which is thinking about how are students doing on grade level skills. That's where you can use the criteria that exists for your screener, because usually assessing grade level skills would involve that screener or and then, or the grade level, like if you're using curriculum-based measurement, it would be the GOM, the grade level measure. And they would usually, that tool typically comes with that benchmark. And then for sub-skill mastery, which I think is really the root of your question, what do you know? How do you know it's mastered or not mastered? And the general rule of thumb for basic facts is 40 to 60 digits correct per minute, which is often similar to problems correct per minute. You can get more information about sort of those metrics. If you look at Brian Ponce's mind, he has some ideas about that. We have different frameworks that have been generated in our book on effective math interventions, because there's 3 different kinds of frameworks that have been used over time. The most recent one is by Amanda Vanderheyden and Matt Burns with that 40 to 60 benchmark. And it's less for procedural skills. It would be more in the 20 to 30 range. Okay. Let's see. The understanding I was getting is that we aren't doing a screener because the data was then actionable. I was alternatively trying to state that we needed a screener because students need help. Oh, you were trying to explain your question. Thanks, Jen. Yes, so I think I'm understanding Jen. So Jen's saying, even if we don't have a pullout or title math, the classroom teacher should be identifying and supporting students who are at risk. So that is true. It would be great to get your school building to provide a structure of support for you. So that would be maybe what you're hoping for too. Okay, the next question, when do you do intervention on basic skills in a school day? So this is a question I had yesterday as well. I love this question because again, similar to my answer to the previous question, this is really a systems level challenge that should be addressed at the systems level. So the best thing, we have When I Need blocks, and that's something that schools have tried to utilize. The problem with When I Need, as all of you know, is that many students need many things, and it's not appropriate. It's really not appropriate to make put teachers or students in the position of having to choose what they get help with. So it's really important that the math block have an instructional time embedded in it, and that other kids can get enrichment during that time. So that's what I would recommend. And then how do you keep pace? Okay, so there's a two-part question here. How do you keep pace with both missing skills and grade level curriculum? So some of that is going for kids that are not meeting grade level expectation. It may not be that they are able to capture all those skills, foundational skills they need, and access grade level curriculum in the course of a year. And I think we need to be okay with that, especially the ones that have the biggest gaps. I don't know if that's helpful, a helpful reframe. One of the things that we increasingly know, and I guess I'll just reiterate this again about those missing skills, because I know this is such a huge issue in math, is we really know a lot now about those missing foundational skills. We know that if you don't have math facts down, and if you are unable to compute multi-digit computation type problems, and if you can't do word problems, it is going to be more challenging for you to access that higher level math content. We know that whole number knowledge, both calculation accuracy and fluency with simple and complex computation, predicts students' performance on algebra ready skills and on their fraction and rational number skills. So you must have those skills to engage in those other big topic areas, so rational number and algebra. And so it's really important that you can't miss those foundational skills, because they're required for students to actually access both rational number knowledge and algebra, and that we have in the data. And so I think that's a thing to keep reminding yourself. And then by monitoring progress on those sub skills, hopefully we're able to move our instruction quicker and see student progress faster. I think that may be one of the challenges. If we haven't been progress monitoring on the sub skills, we might not know when students are capturing it. And so then we are a little unsure of when to move to the next skill or how to progress. Okay, and then the other question, thanks. Do I still have? I'm out of time, but I'll answer this super quick. So one of them was asking. One question is, how do you do one-on-one personalized intervention? So yesterday I talked a little bit about this. Happy to talk about this more on a. If you want to email me, but I actually don't recommend one-on-one service delivery. I think we need to be doing it in small groups. That's what the data and math say. It's just as good to do it in small groups, much more efficient. And then let's see if I can squeeze one more in here. So I'm okay, I'm not entirely sure I'm getting this question. This is from Missy, but it's about using Spring Math. Spring Math is great because it already built in a lot of the sequence that I talked about. It has you do class-wide intervention first. Class-wide intervention first, we know, is more efficient for the reasons that I talked about earlier. You're going to be able to address many students' skills. And then from that, be able to identify those students who truly need additional supports. And then there, we want to be able in our systems to build in opportunities to provide appropriate supports for students. And again, I think the best way to do that is having a block of math time that embeds intervention support. And then we can think about how to utilize the teaching resources we have along the way. And then I'm seeing a lot of things about schedule. All right, I think I've answered the questions that are
Yes.
in the chat.